What is pregabalin? Pregabalin is a medication that belongs to the class of drugs known as anticonvulsants. It is primarily used to treat neuropathic pain, which is pain caused by damage or dysfunction of the nervous system. Pregabalin is also approved for the treatment of certain types of seizures in adults, as well as for the management of fibromyalgia and neuropathic pain associated with diabetic peripheral neuropathy or spinal cord injury. What is the mode of action of pregabalin? Pregabalin exerts its therapeutic effects by interacting with a specific type of protein called the alpha-2 delta subunit. This subunit is part of voltage-gated calcium channels in the central nervous system. Pregabalin binds to the alpha-2 delta subunit, particularly in areas of the brain and spinal cord, and modulates the influx of calcium into nerve cells. The modulation of calcium channels by pregabalin reduces the release of several neurotransmitters, including glutamate, norepinephrine, and substance P. These neurotransmitters play a role in transmitting pain signals in the nervous system. By inhibiting their release, pregabalin helps to dampen excessive nerve activity and alleviate the perception of pain. Pregabalin's mechanism of action is thought to contribute to its efficacy in treating neuropathic pain conditions, seizures, and certain other disorders associated with abnormal nerve signaling. It's important for individuals using pregabalin to follow their healthcare provider's recommendations and be aware of potential side effects and interactions with other medications. What is the detailed pharmacodynamics of pregabalin? The pharmacodynamics of pregabalin involves its interactions with the nervous system, specifically its effects on neurotransmission and neuronal excitability. Pregabalin binds to the alpha-2 delta subunit of voltage-gated calcium channels in the central nervous system. Here are the key aspects of pregabalin's pharmacodynamics. Calcium channel modulation. Pregabalin binds to the alpha-2 delta subunit of voltage-gated calcium channels, primarily in the central nervous system. By binding to this subunit, pregabalin modulates the activity of these channels, reducing the influx of calcium ions into nerve terminals. This modulation decreases the release of various neurotransmitters. Neurotransmitter modulation. Pregabalin's primary effect is the reduction in the release of neurotransmitters, including glutamate, an excitatory neurotransmitter involved in transmitting signals between nerve cells. Pregabalin's modulation helps decrease excessive glutamate release. Norepinephrine, a neurotransmitter that plays a role in the body's stress response. Pregabalin reduces its release, contributing to its anxiolytic, anxiety-reducing, effects. Substance P, a neurotransmitter involved in transmitting pain signals. Pregabalin's modulation helps reduce the release of substance P, which contributes to its analgesic, pain-relieving, effects. Central nervous system effects. Pregabalin's modulation of neurotransmitters and neuronal excitability in the central nervous system contributes to its therapeutic effects. It is particularly effective in managing neuropathic pain and certain types of seizures. Anxiolytic effects. Pregabalin has anxiolytic properties, and it is sometimes prescribed to manage generalized anxiety disorder. The reduction in norepinephrine release and overall dampening of excitatory neurotransmission likely contribute to its anxiolytic effects. Understanding pregabalin's pharmacodynamics provides insight into how the drug affects neural signaling and helps to manage conditions such as neuropathic pain, seizures, and anxiety. It's important to note that individual responses to medications can vary, and pregabalin should be used under the guidance of a healthcare professional. In what strengths and dosage forms pregabalin is available? Pregabalin is available in various strengths and dosage forms, and the specific formulations may vary by region and country. Typically available in strengths of 25 mg, 50 mg, 75 mg, 100 mg, 150 mg, 200 mg, 225 mg, and 300 mg. Similar strengths to capsules, ranging from 25 mg to 300 mg. The dosage prescribed depends on the condition being treated, the individual patient's response to the medication, and other factors. What is the pharmacokinetics of pregabalin? The pharmacokinetics of pregabalin involves the absorption, distribution, metabolism, and elimination of the drug within the body. Here are the key aspects of pregabalin's pharmacokinetics. Pregabalin is well absorbed after oral administration. The absorption is rapid, with peak plasma concentrations achieved within about 1 to 1.5 hours after ingestion. The bioavailability of pregabalin is estimated to be around 90%, indicating that a high percentage of the drug reaches the systemic circulation. Distribution. Pregabalin has a relatively small volume of distribution, suggesting limited distribution into tissues beyond the systemic circulation. It does not extensively bind to plasma proteins, with only about 1% of the drug bound to proteins. Metabolism. Pregabalin undergoes negligible metabolism in the liver. The majority of the administered dose is excreted unchanged in the urine. Pregabalin does not undergo significant hepatic metabolism via the cytochrome P450 enzyme system, which is in contrast to some other medications. Elimination. Pregabalin is primarily eliminated by renal excretion. Unchanged pregabalin accounts for the majority of the excreted drug in the urine. The elimination half-life of pregabalin is approximately 6.3 hours in individuals with normal renal function. Renal impairment. In individuals with impaired renal function, the clearance of pregabalin is reduced, leading to a longer half-life. Therefore, dose adjustments are often necessary in patients with renal impairment to prevent drug accumulation. Dosage adjustments. Pregabalin dosage may need to be adjusted based on renal function. In patients with compromised renal function, lower doses or less frequent dosing may be recommended. Understanding the pharmacokinetics of pregabalin is crucial for healthcare professionals too. Determine appropriate dosing regimens and monitor patients, especially those with renal impairment. What are the reported side effects of pregabalin? Pregabalin, like any medication, can have side effects. It's important for individuals taking pregabalin to be aware of potential adverse reactions and to promptly report any unusual or severe symptoms to their healthcare provider. Common side effects of pregabalin include central nervous system effects, dizziness, drowsiness, fatigue, headache, gastrointestinal effects, nausea, dry mouth, constipation, increased appetite and weight gain, neuropsychiatric effects, confusion, impaired memory, abnormal thinking, visual disturbances, blurred vision, double vision, peripheral edema, swelling of the extremities, musculoskeletal effects, tremor, incoordination. Other common side effects: speech disturbances, increased or decreased blood pressure. It's important to note that not everyone will experience these side effects, and some individuals may tolerate pregabalin well. Additionally, side effects may vary in intensity and duration. In addition to these common side effects, there are also more serious side effects that may occur, albeit less frequently. These can include allergic reactions, rash, itching, swelling, severe dizziness or trouble breathing, rare, suicidal thoughts or behavior. Pregabalin and similar medications have been associated with an increased risk of suicidal thoughts and behavior. Individuals should seek medical attention if they experience changes in mood or behavior. Severe skin reactions, Stevens-Johnson syndrome, rare but serious skin reaction. It's crucial for individuals to communicate openly with their healthcare provider about any side effects or concerns. Additionally, abrupt discontinuation of pregabalin should be avoided, as it may lead to withdrawal symptoms. What are the precautions to be exercised while administering pregabalin? When administering pregabalin, certain precautions should be taken to ensure the safe and effective use of the medication. Here are some important precautions to consider. Renal function. Pregabalin is primarily eliminated through the kidneys. Therefore, individuals with impaired renal function may require dose adjustments to prevent drug accumulation. regular monitoring of renal function is important. Central nervous system effects. Pregabalin may cause dizziness and drowsiness. Patients should be cautioned about activities requiring mental alertness, such as driving, until they know how the drug affects them. Potential for abuse. Pregabalin has the potential for abuse and dependence, particularly among individuals with a history of substance abuse. It should be prescribed and used with caution in such cases. Withdrawal symptoms. Abrupt discontinuation of pregabalin should be avoided, as it may lead to withdrawal symptoms, including insomnia, headache, nausea, anxiety, and hyperhidrosis. Tapering the dose under the guidance of a healthcare professional is recommended if discontinuation is necessary. Suicidal thoughts and behavior. Pregabalin has been associated with an increased risk of suicidal thoughts and behavior. Patients, especially those with a history of depression or other psychiatric disorders, should be monitored for changes in mood or behavior. Allergic reactions. Patients should be monitored for signs of allergic reactions, such as rash, itching, swelling, and difficulty breathing. If such reactions occur, medical attention should be sought immediately. Pregnancy and breastfeeding. The safety of pregabalin in pregnancy and breastfeeding is not well established. It should be used during pregnancy only if the potential benefits justify the potential risks. Breastfeeding while taking pregabalin is not recommended. Drug interactions. Pregabalin may interact with certain medications. It's important to inform healthcare providers about all medications, including over-the-counter drugs and herbal supplements, being taken. Elderly population. Caution is advised when prescribing pregabalin to elderly patients, as they may be more sensitive to its effects. Liver disease. While pregabalin is primarily eliminated through the kidneys, individuals with liver disease should be monitored closely, and dose adjustments may be necessary. Patients should always follow their healthcare provider's instructions and report any unusual or severe side effects. It's essential to have open communication with healthcare professionals to ensure that pregabalin is used safely and effectively. What may interact with medication? Pregabalin. Pregabalin is a medication used to treat neuropathic pain, fibromyalgia, and certain types of seizures. It's important to be aware of potential drug interactions to ensure the safe and effective use of pregabalin. Here are some substances that may interact with pregabalin. Alcohol. Pregabalin and alcohol both have central nervous system depressant effects, and combining them can increase the risk of drowsiness, dizziness, and impaired coordination. Benzodiazepines. Combining pregabalin with benzodiazepines, such as lorazepam or diazepam, can increase the risk of drowsiness and sedation. Opioids. The use of opioids with pregabalin can enhance the central nervous system depressant effects, leading to increased sedation and respiratory depression. Sedative medications. Drugs with sedative effects, such as certain antipsychotics or sleep medications, may interact with pregabalin and intensify sedation. Antidepressants. Some antidepressants, especially those that affect serotonin levels, such as SSRIs and SNRIs, may interact with pregabalin and increase the risk of serotonin syndrome, a potentially life-threatening condition. Diuretics. Pregabalin may cause peripheral edema, swelling of the extremities, and combining it with diuretics can exacerbate this side effect. Drugs that cause dizziness. Medications that cause dizziness or drowsiness, such as certain antihypertensives, antihistamines, or muscle relaxants, may enhance these effects when taken with pregabalin. Interactions with other anti-epileptic drugs. If pregabalin is used in combination with other anti-epileptic medications, there may be an increased risk of side effects. It's crucial to inform your healthcare provider about all the medications, including prescription, over-the-counter, herbal products, and supplements, that you are taking. This information will help your healthcare provider assess the potential for interactions and adjust your treatment plan accordingly. Never start or stop any medication without consulting your healthcare professional. If you experience any unusual side effects or interactions, seek medical attention promptly. What is the dosage of pregabalin? The dosage of pregabalin can vary depending on the medical condition being treated, the individual's response to the medication, and other factors. It's important to follow the prescribing doctor's instructions and the information provided on the medication label. The following are general guidelines for the dosages of pregabalin for some common conditions. Neuropathic pain. Starting dose, usually 150 mg per day divided into 2 or 3 doses. Maintenance dose, the dose can be increased to 300 mg per day after 3 to 7 days based on individual response and tolerability. Maximum dose, 600 mg per day. Fibromyalgia. Starting dose, 75 mg twice daily or 50 mg 3 times daily. Maintenance dose, the dose can be increased to 300 mg to 450 mg per day based on individual response and tolerability. Partial onset seizures. Starting dose, 150 mg per day divided into 2 or 3 doses. Maintenance dose, the dose can be increased to 300 mg per day after 1 week based on individual response and tolerability. Maximum dose, 600 mg per day. It's essential to start pregabalin at a lower dose and gradually increase it to minimize the risk of side effects. The medication is usually taken with or without food, but consistency in administration, with or without food, is recommended. Dosage adjustments may be necessary for individuals with impaired kidney function, as pregabalin is primarily excreted through the kidneys. If you have any concerns or questions about your pregabalin dosage, it's crucial to discuss them with your healthcare provider. They can provide personalized guidance based on your specific medical history and condition. What should I tell my care team before I take this medication? Before starting pregabalin or any new medication, it's important to communicate openly with your healthcare team. Here are some key pieces of information you should share with your care team. Current medications, provide a comprehensive list of all medications you are currently taking, including prescription drugs, over-the-counter medications, herbal supplements, and vitamins. This information helps your healthcare provider assess potential drug interactions. Medical history, inform your care team about your complete medical history, including any pre-existing conditions or diseases. Mention if you have a history of kidney problems, heart problems, or any psychiatric disorders. Allergies, make sure to let your healthcare provider know about any allergies you have, especially if you have had a previous allergic reaction to pregabalin or any similar medications. Pregnancy/breastfeeding. If you are pregnant, planning to become pregnant, or breastfeeding, discuss this with your healthcare provider. Pregabalin may pose risks during pregnancy, and a decision on its use will be based on the potential benefits and risks. Substance use, be honest about your use of alcohol, recreational drugs, or tobacco. These substances can interact with pregabalin and affect its effectiveness. Impaired kidney function. If you have impaired kidney function or are undergoing dialysis, your healthcare provider may need to adjust the dosage of pregabalin. Mental health history. Inform your care team about any history of depression, anxiety, or other mental health conditions. Pregabalin may affect mood, and your healthcare provider will consider this information when prescribing the medication. Driving and operating machinery, pregabalin may cause dizziness and drowsiness. If these side effects affect your ability to drive or operate machinery, discuss this with your healthcare provider. They can provide guidance on how to manage these effects. Other health concerns. If you have any other health concerns or questions, share them with your healthcare provider. What are the comparable similar drugs available to pregabalin? Pregabalin belongs to a class of medications known as gabapentinoids, and it is primarily used to treat neuropathic pain, fibromyalgia, and certain types of seizures. Gabapentin is another medication in the same class, and it shares some similarities with pregabalin. Both drugs affect the way nerves send messages to the brain and can help manage certain types of pain. Here are some comparable drugs to pregabalin. Gabapentin, Neurontin. Like pregabalin, gabapentin is used to treat neuropathic pain, seizures, and certain types of nerve pain associated with shingles. It is available in generic form and is often considered an alternative to pregabalin. Duloxetine, Cymbalta. Duloxetine is an antidepressant that is also used to treat neuropathic pain associated with diabetic peripheral neuropathy and fibromyalgia. It works by increasing the levels of serotonin and norepinephrine in the brain. Amitriptyline, this tricyclic antidepressant is sometimes used for the treatment of neuropathic pain and chronic pain conditions. It affects the levels of neurotransmitters in the brain and can have analgesic, pain-relieving, effects. Nortriptyline, another tricyclic antidepressant, nortriptyline, is sometimes prescribed for neuropathic pain and migraine prevention. Topiramate, Topimax, while primarily an anticonvulsant, topiramate is also used for the prevention of migraines and may have some utility in treating neuropathic pain. It's important to note that individual responses to medications can vary, and the choice of a specific drug depends on the nature of the condition being treated, the patient's medical history, and any potential contraindications or interactions with other medications. What are the popular brands of Pregabalin available? Pregabalin is primarily available as a generic medication, and it may be sold under the generic name Pregabalin, or different brand names depending on the manufacturer and region. Some common brand names for Pregabalin include Lyrica. Lyrica is one of the most well-known and widely used brand names for Pregabalin. It is often prescribed for the treatment of neuropathic pain, fibromyalgia, and certain types of seizures. Pregabit. Pregabit is another brand name for Pregabalin that may be available in certain regions. Pregeb. Pregeb is a brand name under which Pregabalin may be marketed.